I wanted to talk to you both, about what's been going on with Mom. I know you're, both really concerned. But before we sort of get into, what we know, what we don't know, I wanted to find out from you guys, how much do you know about what's going on, or has anybody talked to you?
She started getting lightheaded, and then the nurse had her lay down, and then they put the oxygen mask on her because she needed, her oxygen level was very low, and then they asked us to leave.
Because they weren't really telling us anything.
They weren't
Just a bunch of
telling us
people were
anything,
coming in.
really, what could be done for her?
Right.
Yeah,
Okay.
what?
Well, it's normal to be obviously very concerned. 1 minute she's doing very well, walking around, the next minute there's a million people in her room. So it's okay to be frightened, and I just want to let you know we're going to do everything in our power for her. As we discussed before the surgery, one of the major potential complications of surgery are breathing problems. So it was obvious that she went from breathing fine without any oxygen to being lightheaded and needing some more oxygen. And really what's going on right now is that her oxygen level is low, and she was very breathless, meaning she couldn't breathe on her own, and she was working really hard, very breathless and requiring more oxygen. And all of that implies that there's some process going on that's affecting her lungs. It's not allowing enough oxygen just in the room air to sufficiently meet her needs. So we had to put a higher concentration of oxygen on, and we had to put a breathing tube back in. She was on the breathing tube for the operation. We had to put the breathing tube back in, because if we let her just huff and puff on her own, she would have gotten tired out and would have stopped breathing at some point. So right now where we stand is that she's on the breathing machine, and her oxygen level has stabilized on that, because we're able to give her a little bit more oxygen. But she's ill, and she is probably going to need to go down to the intensive care unit so that we can monitor her more closely.
Mom's going to be okay though, right? I mean, we already knew that these complications could happen. So you guys are prepared for this, right?
Yeah, I know it's really difficult, and it's particularly when 1 minute she looked great and the next minute she's looks sick. So it's understandable that you're going to be very upset, because you care about Mom a lot, and and we care about her as well, and we're going to do everything in our power to take care of this. So we'll try and get her through it as well as we can. But we need to get a little more information, But there's something going on with her lungs, and we don't know exactly what it is. We're getting a chest X-ray right now that the tube went in, to see if there's some issue, like did she collapse her lung? Does she have fluid there in the chest from the surgery? So we're getting the X-ray, and then we'll probably have to get some other tests to see what's going on.
Do you know how long she's going to have to be on the machine?
Oh, on the breathing machine.
Yeah, it's a little early for me to answer that question, because I don't know exactly what's going on. I think that she could be on just for a couple of days. So let's say it's something really easy to correct, like she collapsed her lung. We just have to put a tube in, re-expand her lungs. She'll be off the ventilator. It could be that she has some kind of lung injury, where she has a pneumonia or something, and she might be on the ventilator a little longer. So unfortunately, I don't know exactly, I can't answer your question exactly. I apologize that this has happened to her. Unfortunately, it can happen after the surgery. I think we probably discussed it to some degree, before the surgery. We just have to manage it, and we have to deal with it at this point, and get as much information. Sort of step back and review everything that's happened so far. In what we talked about, is there any questions that came up that weren't answered in what I reviewed, or? So, basically Mom was doing fine, and then she was having some increased breathing problems, such that she couldn't continue to breathe on her own, and so we had to put her on the breathing machine. There's a a number of things that could be causing this, ranging from pneumonia to a blood clot to a collapsed lung. And so I just wanted to review sort of the next steps, what we're going to do and what to expect. Was there anything else you wanted me to cover before I did that? Are you ready to hear what's next? So step one, we've already sort of secured the breathing with the ventilator. Step two is that she needs to be transferred to the intensive care unit so that she can have some more close monitoring. They might have to put some special monitors in, like a blood pressure line in one of her arteries and a bigger, intravenous in one of the bigger veins. So she'll need a couple of bedside procedures, and then she really needs some additional investigations. She'll get a chest X-ray up here before she goes to the intensive care unit, and then she'll probably require a special CAT scan to rule out a blood clot and also look in the chest more closely. When she gets to the intensive care unit and she's had some of these other tests, then there's a whole staff of intensive care unit doctors that can update you, and then I'll try and meet with you all as well, at least a couple times a day to sort of keep you updated on what's going on. Once we've figured out a little bit more specifically what's going on and what the treatment is going to be, I can give you more information about what to expect, what the likelihood is that she'll